Welcome to Changing a Two-Piece Pouching System, a topic from the video series WEB WOC, Ostomy Procedures and Techniques, sponsored by an educational grant from Hollister Incorporated and lectured by Deborah Nate. Using ostomy equipment correctly is an important skill to master, and it increases the nurse and patient's comfort level with performing ostomy cares. A two-piece pouching system includes a pouch and skin barrier. The skin barrier is separate from the pouch, so they are in two pieces. These two pieces are connected by a flange, one on the pouch and one on the skin barrier. These flanges must be the same size and type to fit securely together. Two-piece pouching systems may be drainable for fecal stomas or urostomy for urinary diversion stomas. They may be cut to fit so that the same type of pouching system can be used as the stoma changes sizes by cutting the skin barrier to the size of the stoma, or pre-sized when the stoma size is stabilized. No cutting is needed. The opening on the pre-sized skin barrier cannot be changed. The two-piece pouching system can also be flat or convex. These two-piece pouching systems can also be flat or convex with different formulations in the skin barriers. When do you change the pouching system? Well, the first question nurses usually ask, and patients may wonder as well, is when to change an ostomy pouching system. Drainable pouching systems are to be emptied when 1/3 or 1/2 full. If that does not happen and the pouch overfills, then leaking may result. Additionally, leakage may result from a pouch that is in need of refitting. Whatever the cause, leakage signals an urgent need for a pouch change. Taping leaking pouches is damaging to the peristomal skin and not best practice. Preferably, the drainable pouching system is changed on a schedule, usually in the morning prior to the patient eating or drinking. The schedule may be every 3 to 4 days, but the important point is to avoid leakage and patient embarrassment. Let's review how you would change a two-piece pouch. Many times, your patient can be involved in part or all of these steps as you are teaching self-care. If the patient was transferred from another setting, ostomy pouch change procedure and frequency for pouch changing is located in a teaching folder, transfer orders, or ostomy supply package sent with the patient. First, you will want to assemble the supplies. You will need the following items: the new flange and pouch, stoma measuring guide, a pen and pair of scissors, if the flange is cut to fit size, a disposable bag for your used pouch, water, and some tissues or paper towels for washing and drying the skin. If accessory items are being used in this procedure, assemble those at this time also. Supplies are assembled, you are ready to prepare your new pouching system. If a cut-to-fit skin barrier is to be used, draw the pattern of the stoma onto the back of the skin barrier flange. The skin barrier is then cut out. The fingertips may be used to smooth the inside edge of the skin barrier after it is cut. Remove the paper backing from the skin barrier and set it aside for now, with the adhesive facing up. Save the paper backing on the skin barrier as a pattern for the next pouch change. Date the pattern and throw away old patterns. The bottom on the pouch is then closed with a closure device, or the spout of a urostomy pouch is turned to the off position. If you are using a pre-sized opening, just peel off the backing paper as already described. Set aside with the adhesive facing up. As nurses, you know a great deal about adhesive removal and application. Use those same techniques when removing a pouching system. To review, when removing a pouching system, be cautious and support the skin. Adhesive removal can be non-traumatically done by lifting the edge of the adhesive and peel downward, while gently supporting the skin by pushing it away from the adhesive barrier. Dispose of the used pouch, and if a reusable closure clamp is in use, save it. Skin with water, and if needed, a skin cleanser. Do not use oils, powder lotion, or lotion-type soaps on the skin. Rinse and dry the skin prior to applying the new pouch. If you are using any accessory items, such as an additional skin barrier product, you may apply them now. Wick away any stool or urine that may emit from the stoma during the procedure with a soft paper towel or soft tissue. It is important, however, to keep the skin clean and dry prior to application of the new pouching system. There are two methods for applying a two-piece pouching system. First, apply the flange by centering it over the stoma, then snap on the pouch. Or you may put the flange and pouch together prior to application. Centering the stoma may be easier by applying the flange first. Once the flange and pouch are applied, gently apply pressure to ensure that there is good contact with the skin. Begin next to the stoma and work out toward the edge. Place your hand or the patient's over the barrier and hold it in place for 30 to 60 seconds. The warmth of your hands and gentle pressure will help to activate the adhesive. Finally, if there is a border of tape, remove the paper backing at this time and continue to gently press the tape down against the skin. The patient is encouraged to keep an emergency kit with them so that the items needed for a pouch change are available in the kit when the patient is away from home. As a bedside nurse, you play an important role in rehabilitation of your patient. The basic skill of changing a pouching system is important to master as part of the patient's skill set. Teaching patients, families, how to care for the stoma is essential to their recovery and return to routine activities in their lives.